Now, April 1, 2017, the Schnauzer female with lethargy and bleeding from the vagina, strings of reddish brown thick discharge. Now on X-ray you can see actually the lateral view of a distended uterine horn. See the yellow arrows? One of the horns. And blood test shows that total white cell count is high, neutrophils are high, indicating an infection, and the platelets are low, indicating a toxemia. So this dog was quite ill, so he was given antibiotics and a drip overnight before surgery today at 2 p.m. to our vets. Now you can see the other view, the ventral dorsal view, and this view is also very interesting. You can see the sausage swollen uterine horn, the right and the left uterine horn is quite radiodense. I think you can see here the right one, and the left one is here. Left one, you can see the outline, and then the right one, the outline. So in this case of pyometra, which is a closed pyo, you can see really very clearly from the X-rays. So evidence point to closed pyometra, and the dog was operated today, and you can see from the other video that the uterine horns are really big and distended. This is the blood test results. The significant findings are high urea, and high total white cell count, high neutrophils, indicating an infection of the blood, and low platelets. So the dog is septicemic, the blood poisoning, so it's very weak. And on the X-ray, you can see on the lateral view, you can see a sausage-like uterine horn filled with pus, red and smelly pus. So this is the size which you saw in the X-ray, lateral view, but it's one side you can see. It's no less sausage. Okay, sausage shaped uterine horns. It's full of those dirty reddish brown discharge inside. So far the vet has successfully removed the horns without rupturing it. This is the dog. Has she woken up? Has she woken up? No. No. Still sleeping? Huh? Still sleeping, right? Okay. Sleeping. Any eye movement? Blinking. Where? Let me see. Yeah, because this dog is septic, so didn't respond so well as a normal dog. Are you sure it's blinking? You check the eye. Touch your eyelids. Where? Okay, wait, let me see. Wait, touch. Yeah, correct. Check the gums. What color? Is it pinkish or is purplish? It's very it's pinkish. At least it's pink. It's not purple. It's not white. Okay, so the blood test shows that the red blood cells and hemoglobin is normal. Okay, so this is the operation site, quite a big one. And okay, so you have the scalpel blade. No scalpel blade. You did just on the scalpel blade, throw away. Okay, just cut. No, just one here. For cutting. No, just put the normal one. Normally I put some. Okay, now I just cut. Just cut about 2 centimeter.
Where?
Anywhere will do. You will see
like that?
Just slice like that. Yeah.
Like that.
A bit. Correct. Just. So this why the vet should. So this is to operate fast early. If not, the thing will rupture and all the dirty, toxic. As you can see. So if this dog is not operated, then it will rupture and then the dog will die from peritonitis. And in fact, the skin in the uterine is thinner and thinner because of the infection. It's very smelly pus. So, and this one of the common conditions because it didn't sterilize the dog when she was young. But this dog normally never give birth. So it's a case of closed pyometra. You can see it's about how many centimeter? The longest one. It's about
slightly longer than
12, huh? 12 centimeter. Okay, so you can throw away this. You can see the dog is really in a bad shape, but slowly recovering from anesthesia. In fact, anesthesia, the heart stopped beating and the dog had to be revived, but now she seems to be okay. I've given glucose additionally so that she has some energy, and after that I will give amino acid, which is the protein drip plus vitamin C to ensure that the dog survives post-op. So the best is to sterilize your dog when she's young to avoid closed pyometra, which is hard to detect because of the closed cervix, and pyometra does kill the dog if the treatment is delayed. And see now she's definitely much better, a bit more alert after the glucose IV drip. So there's good news. Now you can see the gums, huh? You see the gums are pale. The pale after surgery, but it's not white. So there is the worry that this dog might die post-op. So we give intensive fluid therapy and amino acid. The patient is definitely much more alert, you can see, after giving the glucose 5% IV for about 10 minutes. Then I continue with Differlite, which is the amino acid drip with vitamins, and that should restore her strength. And she should be able to go home tomorrow, unless the owner insists on bringing home today. Now the thing about drip is IV is still the best. Of course, if the veins are blown, then an experienced nurse may be able to still do it, as you can see from here. And the response actually is quite fast if you have IV drip. If you have just subcutaneous, then the response is not so immediate. So this is Differlite. About 50 ml will do. Today is April 1, 2017, Saturday. Toa Payoh Vet, Singapore. Miniature Schnauzer female, 6 years old, with closed pyometra, with just a few streaks of yellowish brown discharge. Seen history of heat last month. So now the dog is going home. It's about 1.5 hours after surgery. It's recovered and looks alert. Just a 6-year-old female Schnauzer. This is a black and silver, which is quite an uncommon color for Schnauzers. And so far so good. Hello. Hello, hello. Today is Sunday, about 4:30 p.m. Today is Saturday, right? 4:30 p.m. April 1, 2017. Schnauzer is able to walk now, and the vet is discharging her to go home after another bottle of drip amino acids and glucose.